Hello everyone, I'm Dr. Nicholas Haddad. I'm an infectious disease specialist and I work for CMU Health in Saginaw, Michigan. COVID-19 is a coronavirus. Coronaviruses are respiratory viruses, so they acquire the droplet transmission, meaning on small droplets of saliva or respiratory secretions from one person to another. That's how it is transmitted per se for this particular virus, but all other coronaviruses are the same. And examples of those are common cold viruses in the winter, as well as previous coronaviruses that caused some scares within the past 20 years. One is in 2003 and another in 2012. So by respiratory droplets, we mean that when there's a cough or a sneeze or vigorous talking between one person and another, the infected person can infect the non-infected person by sending their route small droplets of saliva which harbor the virus on them. Typically, we require a meter or two, so that's 3 to 6 feet, but sometimes even longer than that, so up to 9 feet transmission can occur. The difference between this and other mechanisms of respiratory transmission is that droplet after a few minutes settle on the ground and are no more infectious. So the transmission occurs when there's close encounters between people within 6 feet and within a distance from the coughing person or the sneezing person who carries the virus. So after acquiring the infection from somebody who has it, the individual would take up to 14 days for the infection to show up. And that's what we call in medicine the incubation period. When we say up to 14 days, it could be as soon as 2 days later or up to 14 days later. And of course, not everybody gets symptoms. As we are going through this pandemic, we are learning more and more on the characteristics of the virus. The majority of people who are infected, maybe up to 80% of them, have very minor symptoms or none at all. And we are not exactly sure of how much percentage that is, but we are learning as we go that many people are asymptomatic or very, very mildly symptomatic, meaning very little symptoms such as common cold symptoms or even less than that. So the remaining 20% of people who acquire the virus and become symptomatic within the incubation period of 14 days, those are the ones who are getting sicker and are requiring hospitalization. The majority of them, maybe up to 15%, have a very sick course, but they ultimately recover and go home. Whereas 5% unfortunately are very severely ill, may require intensive care and ultimately expire.